Hello everyone and welcome to the AM edition of Newsfeed with me, Hugo Ribatika. In a moment, you can expect some insightful reflections on the Health Hub as we head into the world of health news. This is a brand new segment here on Newsfeed AM where we bring you in-depth coverage from the Bekisisa Centre for Health Journalism. We'll sit down with Bekisisa's editor-in-chief, Mia Malan, every Sunday at 9 a.m. to unpack it all for you in the Health Hub. But before we do that, let's take a look at the day's leading stories. The Hawks have arrested 2 suspects for incitement to commit public violence in Gauteng and KZN. The unrest last month in these provinces left malls and warehouses looted and damaged. Basic Education Minister Angie Motshekga will brief media on the basic education sector's response to the impact of COVID-19 on schooling. The number of children involved in sex work has risen from 18% to 30% in Zimbabwe. According to civil society groups, many young women have to resort to sex work in order to survive. Let's get things going in the Health Hub this morning. Now, this is the AM edition of a Newsfeed on Channel 405 and the Health Hub's third installment with Bekisisa's editor-in-chief, Mia Malan, joining us in studio. Hi, Mia. Great to see you. Another great show lined up. What can we expect this morning?
We'll talk about the impact of femicide on victims' children, and we'll have someone in the studio who was vaccine hesitant but then decided to get vaccinated, and there'll be an expert who will give us tips on just how to talk to that person in our family or a friend who does not want to get vaccinated.
This week, very, very sadly, Nosicelo Mtabeni, a student, was killed, cut up into pieces. Her boyfriend has admitted to the murder. But women being murdered by their intimate partners is not uncommon in South Africa, is it?
Women get murdered every day just because they're women. And the Justice Department tells us that the most common form of femicide is intimate femicide. And that's when a boyfriend or a husband, so an intimate partner, kills a woman. Now, here you can see data of media reports between 2018 and 2020 that Bekisisa and media had compiled. And the reason we looked at media reports is because police statistics don't give you all this data on how someone was killed or why they were killed. It generally, the annual statistics tells you how many murders they were, but they don't tell you the gender of the person. So if we look at who kills women, we can clearly see here that intimate partners are the most common killers of women, and that in many cases, we also just don't have enough information to know who killed a woman.
Mia, we know who kills women, obviously, and it's glaring, but how are they killed?
If we look at the media reports again, we can see that in most cases, we just don't know how a woman was killed. But in those cases that we do have information for, we see that women most commonly get stabbed, get shot, get beaten and strangled to death.
I mean, we hear a lot about femicide incidents, but we don't hear so much on the issues around mental health, particularly for those individuals or the surviving family members.
Yes, and what we often forget is that many femicide victims leave behind children who then have mental health consequences for the rest of their lives. And to look at this, Bekisisa's reporters a few months ago, Joan van Dijk and Dylan Bush, travelled to Bushbuck Ridge in Mpumalanga to look at this issue. And there they found a gogo, Klesi Sakome, whose daughter Gloria was stabbed to death by her boyfriend. And she left behind 2 small children, a son and a daughter, who were 11 and 3 at the time of her murder. Here's how Klesi found out about her daughter's death.
That policeman said to me, "Your daughter is with her husband. There is no problem. You will bring her in the morning." Then I said, "No, they are always fighting." But he said, "It's okay, we'll take it from tomorrow morning." I wake up early in the morning, I phone work, telling them that I won't come to work. I will go and search my daughter. I went on Monday and found my child. I found my child lying there with a throat cut. Then boy killed my child. My daughter is now 30. I don't know how to tell the children. If I look at them, I just cry. I don't know what to tell them. Your father killed your mother.
You know, that all is very, very difficult to digest, really, Mia. Now, as a child, to hear that your father killed your mother must be absolutely traumatic for the rest of your life.
Yes, the mental health consequences are obviously immense. So I spoke to a psychologist to hear more about how the development of a child would be affected by a murder like this. Let's hear.
I don't think I can even fully explain the level of pain that this causes for children. First of all, their cortex, which is the part of our brain that enables us to make sense of a really painful experience and be able to tell a story and put some kind of meaning, which we know really helps with trauma, is not yet developed. That only gets developed when you are around 18. And also the tendency of children is that when they experience really challenging things, they think that it is them. They are the one to blame. Maybe they did something wrong. So definitely it is likely to impact kids in ways that I don't think we're fully appreciated. There's a lot of work done that shows that extreme childhood adversity can have huge impacts later on as an adult, you know, even on your health and interpersonal relationships, and can impact their schooling, all the significant areas of their lives.
If we look at the long-term effects of femicide on the children of femicide victims, do such incidents impact on their likelihood to become victims of gender-based violence themselves?
I think studies have actually shown, right, that when children are exposed to their domestic violence, especially physical violence, shaming violence that feeds into anger and rage, they are likely to also perpetuate the violence later on in life. However, other violence such as sexual abuse, what we find is that children who are exposed to that are actually much more likely later on in life to be more sympathetic to others rather than to perpetuate them. So there is a linkages between the perpetuation of violence, being exposed to domestic violence, and later on being able to do that. And I always say that, you know, in the majority of cases, we know that in any society, you might have 3% of people who are just antisocial. But in the majority of cases, there is that traumatized boy that never dealt with their pain, that never dealt with their trauma, that also influences some of the violent behaviors.
So if we look at solutions, is there a way that mental health services can help such children to process this trauma and then it becomes less damaging in their lives?
Oh no, yeah, definitely. So there's been a lot of advancement in the field of traumatic stress. And the good news is that as deep and as difficult as this pain is, they can be work. They can be work, first of all, I think at a family level. Studies show that the family can become a container and a facilitator for the healing, to really train people like, you know, their grandmother. If she can get healed, she will have a better capacity to contain the pain of the children and make it more bearable. And I think we haven't fully appreciated the role of the family in either enabling domestic violence, but also in facilitating healing. And there can definitely be interventions for the children themselves to just help them to process the trauma. And some of them might be now, you know, when the trauma is acute, but in the long term, you know, when they reach significant areas of their life, when young girls enter puberty, they miss their mother, they just need to know that then they are likely to be triggered and there can be services that are available to actually help them. And there are trained trauma counselors who can actually be able to support children when they go through experiences like this.
The big question is, do we have these counselors available in our public health service? So if someone doesn't have medical aid, what do they do?
Yeah, big question. big question. So I think we have social workers in South Africa that have been trained. We know the Department of Health has psychologists. But of course, the reality is that there is not enough. Most of the social workers are so overwhelmed dealing with, social issues and social cases. They'll tell you they don't have enough time to provide the kind of attentive therapy that is required to be given to these children. So at the end of the day, you really find that civil society carries most of the burden of providing the services for care. And it is really unfortunate that those that then have medical aid or means are able to get the support either in their schools. Most private schools have psychologists there, or they use the medical aid. But if you don't have money, it is really, really difficult to get these services.
That was Nomfundo Mogapi, and she's the chairperson of the Mental Wellness Initiative. So, Hugo, services are available, but we don't have enough of them.
Yeah, I think it's pretty clear that we are definitely lacking in that regard, Mia. Now, as we move on, you certainly can look forward to a lot more coming up. We continue with the Health Hub after this, delving into the topic of vaccine hesitancy. Are you hesitant about getting the vaccine shot? We speak to someone who was not convinced about vaccination and ask what convinced them to get vaccinated. Stay with us.